Back pain. It's a universal language, a shared experience that transcends age, culture, and occupation. Almost everyone at some point in their lives will feel that familiar twinge, that nagging ache, that debilitating spasm in their back. Why is back pain so common? Our spines are marvels of engineering, intricate structures designed to provide support, flexibility, and protection. But this complexity also makes them vulnerable to injury and degeneration. Everyday activities, from lifting heavy objects to sitting for prolonged periods, can take a toll on our backs. Add to that the natural aging process, poor posture, and underlying medical conditions, and it's no surprise that back pain is a leading cause of disability worldwide. Understanding back pain, its causes, symptoms, and treatment options, is the first step towards finding relief and preventing future episodes. Back pain is not a one-size-fits-all condition. It presents in various forms, each with its own set of characteristics and implications. Acute back pain is the most common type. It typically comes on suddenly, often after a specific event like lifting or twisting. The pain is usually sharp and intense, lasting for a few days or weeks before gradually subsiding. Subacute back pain, as the name suggests, falls somewhere between acute and chronic. It persists for longer than acute pain, typically between 4 to 12 weeks, and may indicate a more significant underlying issue. Chronic back pain is the most debilitating form. It's defined as pain that lasts for more than 12 weeks, often lingering even after the initial injury or cause has healed. Chronic back pain can significantly impact daily life, affecting mobility, sleep, and emotional well-being. Pinpointing the exact cause of back pain can be challenging. In many cases, it's not a single factor but a combination of issues that contribute to the problem. Mechanical causes are among the most common, encompassing muscle strains, ligament sprains, herniated discs, and spinal stenosis. These conditions often result from overuse, poor posture, or sudden awkward movements. Degenerative changes in the spine, such as osteoarthritis and degenerative disc disease, are another major contributor to back pain, particularly in older adults. Infections, though less prevalent, can also affect the spine, leading to pain and inflammation. These include osteomyelitis, or bone infection, and discitis, or disc infection. Malignant tumors that originate in the spine or spread from other parts of the body can cause severe back pain. Rheumatologic conditions such as ankylosing spondylitis and rheumatoid arthritis can also affect the spine, causing pain, stiffness, and inflammation. Extraspinal causes, while not directly related to the spine, can also manifest as back pain. These include kidney stones, endometriosis, and abdominal aortic aneurysms. Back pain can manifest in various ways, from a dull ache to a sharp shooting pain. The location and intensity of the pain can provide clues about the underlying cause. Common symptoms include pain that worsens with certain movements such as bending, lifting, or twisting, muscle stiffness and spasms, pain that radiates down the leg, known as sciatica, numbness or tingling in the legs or feet, and weakness in the legs. Several risk factors can increase the likelihood of experiencing back pain. Age, as back pain becomes more common with age, peaking between 35 and 55 years old. Fitness level, with a sedentary lifestyle and weak core muscles increasing the risk of back injury. Occupation, particularly jobs that involve heavy lifting, repetitive motions, or prolonged sitting. Smoking, as nicotine restricts blood flow to the spine, impairing its ability to heal. Obesity, as excess weight puts added stress on the back. And genetics, as some people are genetically predisposed to back problems. Section 5. The Diagnostic Journey. Unveiling the source of pain. Diagnosing the cause of back pain typically begins with a thorough medical history and physical examination. The doctor will ask about the onset and duration of the pain, the location and intensity of the pain, aggravating and relieving factors, and any previous back injuries or medical conditions. The physical exam will include assessing posture and range of motion, checking for muscle weakness or tenderness, and evaluating reflexes and sensation in the legs and feet. Imaging tests may be ordered to provide a more detailed view of the spine and surrounding structures. These may include X-rays to visualize the bones in the spine, MRI to provide detailed images of the soft tissues including discs, ligaments, and nerves, Kinetic scan to create cross-sectional images of the spine and surrounding structures, and bone scan to detect infections, fractures, or tumors in the bones. The choice of imaging test depends on the suspected cause of the pain and the individual's medical history. Section 6. Managing back pain, a multimodal approach. Managing back pain typically involves a multifaceted approach, tailored to the individual's specific needs and the underlying cause of their pain. The primary goal is to relieve pain, improve function, and prevent future episodes. Treatment options can be broadly categorized into conservative measures, which are the first line of treatment for most cases of back pain and include medications, physical therapy, and lifestyle modifications, interventional procedures, which are minimally invasive procedures that aim to relieve pain and inflammation, and finally, surgery, which is typically reserved for cases where conservative measures have failed to provide adequate relief, or when there is a structural problem requiring surgical correction. Section 7. Finding relief: conservative measures and alternative therapies. Conservative measures are often the cornerstone of back pain management. These non-invasive approaches aim to reduce pain, improve mobility, and promote healing. Medications include over-the-counter pain relievers such as ibuprofen or naproxen, which can help reduce inflammation and pain. Muscle relaxants can alleviate muscle spasms. In some cases, prescription pain medications or antidepressants may be necessary to manage pain. Physical therapy is a cornerstone of back pain management, focusing on exercises to strengthen core muscles, improve flexibility, and restore proper movement patterns. Therapists may also use modalities like heat, ice, ultrasound, or electrical stimulation to reduce pain and inflammation. Lifestyle modifications include maintaining good posture, both when sitting and standing, which can reduce stress on the back. Lifting heavy objects with proper technique, using the legs rather than the back. Losing weight if overweight or obese can significantly reduce strain on the spine. Quitting smoking can improve blood flow and enhance healing. Alternative therapies such as acupuncture, massage therapy, and chiropractic care can provide pain relief and improve mobility for some individuals. Yoga and Pilates can strengthen core muscles and improve flexibility. Section 8. When surgery becomes an option, addressing complex cases. Surgery is typically considered a last resort for back pain, reserved for cases where conservative measures have failed to provide adequate relief, or when there is a structural problem requiring surgical correction. Conditions that may warrant surgery include a severe herniated disc that is compressing a nerve root, spinal stenosis, which is a narrowing of the spinal canal that puts pressure on the spinal cord or nerves, spinal instability where the vertebrae are no longer properly aligned, spinal fractures, and tumors or infections affecting the spine. Types of back surgery include discectomy, which is the removal of a portion of a herniated disc that is pressing on a nerve. Laminectomy, which is the removal of a portion of the lamina, the bony arch of a vertebra, to relieve pressure on the spinal cord or nerves. And spinal fusion, which involves joining two or more vertebrae together to stabilize the spine. The decision to proceed with surgery is made on a case-by-case basis, considering the individual's symptoms, overall health, and the potential risks and benefits of the procedure. Section 9. Conclusion: empowering yourself for a pain-free back. Back pain is a common but complex problem that can significantly impact quality of life. Understanding the causes, symptoms, and treatment options is crucial for effectively managing back pain and preventing future episodes. Conservative measures such as medication, physical therapy, and lifestyle modifications are often the first line of treatment and can provide significant relief for many individuals. In cases where conservative measures are ineffective or when there is a structural problem requiring correction, surgery may be an option. By taking a proactive approach to back health, incorporating ergonomic principles into daily life, and seeking timely medical attention when needed, individuals can empower themselves to live pain-free and maintain a healthy, active lifestyle.